everybody, and thank you for joining Wednesday Wellness. I'm your host, Leora Acoca. I'm an exercise physiologist and a wellness coach. And we have here today Dr. Randall Feingold, who is the co-founder of New York Breast Reconstruction and Aesthetic Plastic Surgery. We're going to discuss today how to restore anatomically the chest wall after explanting, and we'll look into the need to rehabilitate with functional exercises. Thank you, Dr. Feingold, for being here tonight.
Thank you, Leora. My practice has focused on breast plastic surgery for 31 years, both cosmetic and reconstructive. So I have done thousands, probably tens of thousands of breast procedures with a big focus on rehabilitating women after implant surgery that has caused problems for them. So I'm very familiar with the changes in the chest wall after breast reconstruction, many of which are bothersome to patients. And so I'm happy to discuss this with you today.
Perfect. The first question is, what happens anatomically to the chest wall during breast augmentation?
So, historically, when breast implants were first developed, plastic surgeons started using them by placing them above the pectoralis muscle, between the breast and the pectoralis muscle. There were many unsatisfactory results and complications, some of which may have been related to technique and the implant design, the engineering itself, but they often blamed the position above the muscle as the cause, which may not have been a correct explanation. In any case, for many decades after that, breast implants were then placed under the pectoralis muscle in an attempt to achieve better results. When an implant is placed under a woman's pectoralis muscle, an incision is made under the border, the lower edge of the pec muscle, to create a pocket under the muscle. And in many women, that will include making an incision through the muscle fibers, particularly at the bottom close to the sternum on either side, to allow the pec muscle to lift off of the rib cage to create a space to accommodate the implant. So this is a permanent alteration in the shape, the position, and the power of the pectoralis muscle. And the pectoralis muscle wasn't designed to wrap around an implant. It takes its origins on the rib cage and the sternum. And as it moves toward the shoulder, it narrows and tapers into a smaller tendon that attaches, to the humerus. You cut those muscles off the rib cage, you're changing the geometry of the muscle and how it moves your arm. It changes the power. And in many patients, there's spasm of that muscle chronically over the years. There's tightening and scarring of the muscle. And moving their arms causes deformity of the implant in many patients, or it forces the implants to go down and out to the sides instead of staying in the center of the chest. So, we know that alterations of the pectoralis muscle can have a negative impact on the implant result. And when an implant is removed, the pectoralis muscle is no longer the way it was before the implant surgery. And I think that's what you want to talk about today.
As a patient, one of the things that was really outstanding is that you were talking also about muscle reattachment other than just removing the breast implants. And I think that as time went by, I realized more and more how important reattachment of the muscle is, because I was losing strength, when I had breast implant. I thought it was just my weakness, but I didn't realize that the alteration in the muscle, specifically, like you mentioned, the pectoralis muscle that is attached to the top of them, is really altering the way it functions. And
even if you're not an athlete,
even
if you don't go to the gym on a regular basis or participate in some type of programs for, strength or heart training, we use our arms every day for our normal activities. And if it's been cut and it hasn't been repaired, its position will change on the chest wall. It may window shade up, and in thin patients, it may even show an abnormality through the skin. So, of course, many of my patients are fitness conscious. They do exercise. They take different classes in yoga or play tennis or golf or swim. And
Mm-hmm.
so I find that the majority of my patients are already aware that something has been altered. And if they've gone for other consultations, some of them have heard that it's not necessary to repair the muscle or that it's not possible to repair the muscle. Of course, those aren't true. And we can talk a little bit more about, how it's done and why it's important.
So let's first go to also, let's talk a little bit more about the changes in the rib cage. And just because the implants are pushing against the rib cage and not allowing us to take a deep breath. So is there something, are there the intercostal muscle, are they also being impaired or dissected during that surgery?
Sometimes we'll see deformation or changes in the shape of ribs.
Yeah.
Implants, particularly if they're large implants. The pec muscle tightens hard, pushes the implant against the
Yeah.
ribs, and you would think the ribs are rock hard and stable, but some of it is cartilage, some of it's
Yeah.
bone, but it can be deformed. And I have many patients that are breast cancer patients who've had mastectomies. Their breast reconstruction started with a tissue expander,
Yeah.
which is an inflatable implant placed under their pectoralis muscle.
Mm-hmm.
And after inflation of those expanders and the expander is removed to place an implant, you can visibly see the impact of that expansion process deforming, or indenting their rib cage.
Yeah.
So that patients can have mechanical, alterations in the rib cage from expanders and implants, and it can definitely cause difficulty with breathing in some patients, which causes anxiety.
Is there any reason though why when I had, for example, my breast implants, I didn't notice the changes? I felt it, but only when I removed it, when I explanted it, I sort of saw the changes in the rib cage. My upper arm was not as toned, that area here, just along the upper top rib cage, ribs was really needed to be toned. And so, is there a reason why you see these changes more when you explant, but not during your breast augmentation time?
I think when the implant is in place, it may camouflage
Yeah,
the thinning or attenuation
yeah,
of pectoralis muscle, of breast tissue, of the subcutaneous fat just under the skin level.
yeah,
Then when you explant, you see that the breast does not resemble the breast as it looked before the implant was placed because there's been soft tissue thinning and alteration throughout the levels of the breast because of
yeah.
the chronic presence of that implant. And so it may be more evident afterwards, particularly if the muscle is not repaired and not, the way God designed it.
So when we prepared the ebook, which is actually explaining, I think, giving a background to the changes that occur during breast augmentation and then explant surgery, and how women should train, these specific muscles so they can get stronger again before they move on to more difficult exercises. I think that's important to understand also how it's affecting the posture, movement, and also breathing. And why don't we talk a little bit about this? Because I think it's so important when you come out of explant surgery. So you don't want to blame everything on the explant. I mean, you have to understand that this is a precondition that happened during breast augmentation. But let's look at the changes that happen in the posture, in the breathing, tightness in the rib cage, and so on.
I mean, you can, better describe for all of us
Yeah, I can do it.
change your posture, because you lived through it.
Yeah,
I haven't, but I've observed this, of course, in many patients, but
yeah,
you're not going to be able to condition the muscle and, restore if you don't put the pectoralis muscle back in its original, geometry when the explantation is done. And, I see back cuts along the sternum in pectoralis muscles. I see pectoralis muscles that have been terribly thinned I've seen pectoralis muscles that have window shaded up north toward the clavicle, and they're no longer secure against the rib cage or the
Ribs.
sternum. And
Yeah.
you need an origin of a muscle to allow, the arm to move toward the center of your chest
Yeah.
because the insertion moves toward the origin. So you have to reattach the pectoralis muscle to the rib cage, to the pec minor, to the serratus anterior muscle, wherever you can get a secure purchase. And then I don't want patients doing the pec deck or the bench press or the push up,
Yeah.
for, 6 weeks after, that kind of reattachment, because we don't want to put all the energy right onto that repair site. I think it's going to hurt. So they're probably not looking to do that when they start other activities, but you need to use sutures. And I do use long acting sutures, but they are absorbable sutures because we're not looking to leave permanent foreign material in the chest, in the breast after explant surgery. But you have to put the muscle back in place, elongate it if it's been shortened, securely reattach it with sutures that will last for many, many months, and then, not start the exercises you're talking about or
Yeah.
the yoga, which could be really fantastic for you, for probably 6 weeks after these procedures.
Yeah, I think that I became first aware of my difficulties in taking a deep breath when I started meditating. Sort of, you get, when I had the breast implant, I got used to have that shallow breathing.
In order for you to take a deep breath, you use your diaphragm
Yeah, that's
to
right.
allow air to move into a
Yeah.
rib cage, but also the ribs have to separate from each other,
Yeah.
and the excursion of those ribs away from each other with the cooperation of the intercostal muscles allows you to take a deep breath.
Yeah.
If those intercostal muscles are being pressured by an implant that's squeezed between the pec muscle and the rib cage, between the pec muscle and the intercostal muscles, those intercostal muscles may have some spasm. They may not
Yeah.
relax appropriately. They may have reduced ability to expand the rib cage because of the presence of the implant. So I have many patients who have significant inhalational, restrictions
Yeah.
prior to their capsulectomy and explant, and they are dramatically relieved afterwards by removing the implant and also the capsule because it's like plastered on their rib cage and preventing excursion or widening of the interspaces to allow you to take that deep breath.
Yeah.
You
That's why I
have
like
to
so
wait till
much.
after surgery to appreciate how much restriction you had on your breathing, because then you don't have that restriction and you say, wow, that's really different. I didn't realize how much impact it had.
Yeah, I was saying that that's why I like so much, for example, Pilates exercises, because the very core and foundation is all about breathing into the rib cage and reteaching, actually, re-educating your rib cage to expand in four direction, like to the side, to the top, to the back. And that's something that when you had breast implant, I had breast implant, I couldn't do. So, and that's what actually tone up also your upper torso. So that is so important because I think that a lot of women are also, especially those that want to do breast augmentation, they're into how they look. They want to look sexy, feminine, and the issue with explanting is that you are, removing, you are, I would say, restructuring the way your body is looking, and nobody really talks about, hey, once your doctor, have done muscle reattachment and taking care of the anatomy, now you have to think about the function. And obviously, if we train a muscle properly and it function well, we can reshape, the arms, the shoulders, the upper torso. So I think that's a very important one.
You bring up a very valid point because removing the capsule may relieve some of the restrictions on expansion, but you're going to get new scar tissue in a surgical site, put it through range of motion, through stretch, and that pec muscle, you can reattach it, but now it's got scar tissue under its surface, on its surface from doing the explant surgery.
Yeah.
It can still have scar tightening if you don't use it well after surgery. So it makes sense to take capsules out. It makes sense to repair pectoralis muscles, but at some interval after surgery, when there isn't that much pain and when there's no fear of tearing the muscle, then you have to start reconditioning it. And whether it's breathing exercises or Pilates or yoga, strength training, stretch or exercise training with or without a trainer, you're not going to get all the benefits of the surgical reconstruction if you're not going to condition your chest wall. Otherwise you're going to be sort of like protective and tight and not able, to get the benefits of it.
Yeah, I agree. And I think that as an exercise physiologist, a Pilates teacher, I find that doing isometric exercises where you get like scapula push-up, where you get the muscles strong, but you're not moving yet. Because when you move, you may move from different areas that you're not supposed to and injure yourself. So that's why in the ebook, we created this kind of a progression that going from gentle breath, I'm reading it, breath work, posture awareness to actually moving. Once you get stronger, moving and doing more and more, I would say not complicated, but movement that require not only strength, but also awareness and using the proper muscle. And a muscle that has not been used for 10 years or 15 years that you had breast augmentation has probably forgotten how to move, and you have to re-educate it.
It's not a lost cause.
That's the good news.
It still has, nerves,
But you need to work hard for
nerves
that.
to it that allow it to contract. And, women fortunately have many resources out there to get range of motion and stretch and tone and even, real muscle strength with resistance training or in compound exercises, with proper supervision. So
Yeah,
people should, really, look forward to getting back to that after these surgeries. But you have to have a little bit of discipline. At some point you have to get some supervision, I suppose, and not just try it on your
yeah.
own. And there are going to be better times ahead.
So let's talk a little bit about for women what they have to look for in terms of signs that show that the chest wall has not fully healed. So meaning that they're running. I mean, I can share later my experience, but how do you know that when you start exercising that you have not fully healed and maybe you have to back up a little bit, get stronger, and then move on with your progression?
We know there's going to be a short period of time after surgeries where you could make something bleed if you work out a muscle that's been reattached, or even just by raising your pulse and blood pressure by, even being on a treadmill. And that's probably the first 2-week period.
Yeah.
The next 2 to 3 week period, you're going to be outside the window of bleeding, but you're still going to have soreness there. And so if you test the waters between, say, week 2 and week 6, you're going to find that you're going to get feedback from your body.
Yeah.
It may be sore. It may give you a pinch or a jab.
Exactly.
If you
Yeah.
do too much range of motion, or if you're using too much weight. So we just want everybody to use, common sense early on. Certainly after 6 weeks, I'm not concerned that they're really going to tear the muscle repair.
Yeah.
But everybody's body heals at different rates. If someone feels at 6 weeks that they can apply a lot of energy, that's great. But there's still going to be people out there that are just tender to the touch, or they're going to have pain when they put too much range of motion, into it. And you just have to take cues from your body, in terms of the feedback that you get.
Exactly. You have to be.
Whether you're healed enough. But certainly by 8 weeks, I would think most people are going to be able to get back to doing most activities.
I agree because I remember when I started being a Pilates teacher, I wanted to do right away a lot of things. And the pain the next day will guide me where I felt, oh, I've done too much and I have to back up a little bit and just let it rest before. And so you have to be careful. You have to listen to your body, obviously. So, it's interesting because, as a Pilates teacher, I often see a lot of women, wearing very tight clothes, and you can tell who has breast augmentation, who doesn't. And we get into this conversation, and I recently had this interesting conversation with a beautiful girl who is 40, who had just found out that she had 2 ruptured implants, but she was very thin and she was very concerned. And of course, she was going to remove it, but she was going to remove them and exchange it with another set of breast implants. So I asked her, like, why are you not just doing some fat grafting? She says, well, there is nowhere to take it from, whatever. And I think that we have to talk a little bit about women that are really interested to go more natural, but they're very thin. And when they are explanting, they are interested to find out what are the ways they can restore their breast, also their chest.
So first of all, people who have ruptured implants, they should value their health primarily.
Absolutely.
I know it's easy to say, but the contour, the size of the breast probably is a little bit less important than your health at that point.
Yeah.
Because leak silicone gel causes more of a contracture reaction. You're going to have more symptoms, more impact on your pec muscle and your chest wall. And for some patients, that gel can migrate into lymph nodes in their chest, their armpit.
Oh,
I've
wow.
seen it in the neck in some patients. So,
Wow.
that explant surgery is very important. And yes, there may be some, pressure, psychologic pressure or concern about immediately restoring their breast volume. I have so many patients with enough excess body fat somewhere, their tummy, their hips, their lower back, their inner thigh, etc., that I can restore their volume with fat grafting without an implant. And many of those women say if they knew it would look that good before they did their implant surgery,
Yeah.
they may not have chosen implants. They might have chosen their own, tissue. But I also have many patients that are very, very thin. They don't have enough autologous or natural, tissue fat
Yeah.
to transfer to or donate to the breast. And then they have some bigger decisions to make about whether they should put another implant in, and I tell patients, let's go for treating your health first. Let's do a
That's very good
proper
advice.
capsulectomy explant. Let's repair your pec muscle. Let's see how you look. Let's see how you feel. And you'd be surprised how many of those women, if they stage it and don't immediately go for another implant,
Yeah.
are
Mhm.
happier than they thought they were going to be. And they've lost interest in going back to putting another implant in, even if they don't have the body fat. They discover comfort, a sense of relief. Their
Yeah.
breathing has improved so much. They're able to get their range of motion and their exercise tolerance up. So, there's no reason to rush to put an implant back in. You might want to see how you feel and see how you look, and then, make decisions in a better state of mind, down the road.
Well, that's a good advice, I think, to stage it and take it, one step at a time. I want to ask you, I recently saw something on Instagram, I don't know how reliable it is, that now you can actually have fat transfer from a donor person that they are.
So
Have you heard about this?
just as there are cadaver donors for organs,
Yeah.
there are cadaver donors for skin products, skin
Mm-hmm.
substitutes. We call them dermal matrices.
Mm-hmm.
And now there's a cadaver product for fat transfer.
Good.
And taking fat that's been treated to eliminate immunologic risk or
Yeah.
infectious risk
Mm-hmm.
and use that matrix of fat as an injectable filler is relatively new on the marketplace.
Yeah.
So
Would you consider doing it?
so I don't have enough data
Mm-hmm.
in terms of survival. I will tell you because of its significant expense
Okay.
that it's been used in the hip for women that have hip dips where they don't like
Mm-hmm.
the contour of their hips. It's been used in breast reconstruction to improve contour of the cleavage after someone's had some form of breast reconstruction and needs more volume.
Hmm.
I imagine it's been used in buttock augmentation. I don't have any experience, with that.
Yeah.
But as someone who's used a lot of fat grafting in my patients, both
Yeah.
cosmetic and reconstructive, because it's natural tissue, there's no silicone involved or foreign material. And I do, a couple of hundred of those types of procedures a year in my practice for many,
Yeah.
many years now. I have started to use that fat product, but only in a couple of patients.
Hmm.
Results have looked spectacular in terms of instantaneous result without harvesting fat from their body because they don't have fat. So there's
Yeah.
no donor site, there's no liposuction involved. It's just some anesthesia at the entry point, and it's an injection of a semi-solid, semi-liquid
Yeah.
structural material. So I know it has the attractiveness of no donor site, and it helps people who don't have body fat to bring to the table. But there is significant cost. That's not going to get covered by an insurance company for restoration of the breast after explant or for the hip dips or for the buttocks. So, patients would have to consult with their doctor, find out if they have access to use that product because it may not be accessible to all plastic
Mm.
surgeons yet.
Okay, I get
Hopefully it
it.
will with time, but I don't have enough long-term experience in my community to, make long-term predictions for patients. I just know that it's been used at enough sites around the country and world, in different parts of the body with
Yeah.
enough longevity just in the last couple of years
Yeah.
to show that it's productive, but we're still in the, early phase with it, but it is very encouraging.
Yeah, I think it is because it avoids the liposuction part, and many women are concerned about changes in the way the body is shaped. And so that's a, you can skip one
I have
procedure.
plenty of patients that have some extra fat to donate to the project, and
I can donate a little bit
we
too.
call it robbing from the rich and giving to the poor
Yeah,
because
I
you
know.
take it away for someone's belly or inner thigh where they want to get rid of it, and you put it in their
Yeah,
breast where they're somewhat deficient, and it's like a win-win all around. But
yeah.
yes, there's a donor site. But if a patient had adequate body fat to donate to building a better breast, better
Hmm.
breast
Hmm.
contour or volume,
Hmm.
I would not suggest using a manufactured structural product from donor material.
Yeah, I agree.
Was, still, using your own tissue for its own healing purposes makes the most sense to me.
So let's go back, um, really wrap it up because as we know, healing is not only surgical, and that's your part in plastic surgery, but it's also functional, and it's like the marriage of the two worlds if we want to get the best results. So I think here is my opinion. I think that somehow trainers or I don't think even physical therapists, but trainers and medical practices should somehow get together to even offer women some kind of rehabilitation. And this is what we're attempting to do here, for free to our community, is create that kind of a protocol program of at least having like 10 to 12 exercises where they do the minimum to re-strengthen themselves, work on their structure to get stronger and to avoid any injuries in the future. So I would like, personally myself, I would like to see more of that marriage of plastic surgeon and even Pilates studios or yoga studios. So trainers should understand that a chest that has been reconstructed is not, it could never be the same as if it wasn't. And I think that's the key there. You have to really work with what you can do and how you can do. And it's different than before, you went through these surgeries.
It is different, but it is improvable,
It is.
and it may even be both, cosmetically and in terms of range of motion and power down the road if you get, assistance. And for those medical offices or for those physical therapy groups or those trainers to have a better understanding of this, we all rely on people like you
Yeah.
by spreading, your knowledge from experience, personal experience, and by helping so many that you've treated over the years through your studio and through your knowledge. And that ebook is a great contribution to get awareness out there.
Yeah.
And hopefully patients will read it, and trainers and studios, so that other people can offer what you've been offering.
Yeah. The second thing is about once you have an ebook, that's really the beginning. And then obviously my second project will be creating a video that shows exactly how to work and strengthen this muscle. And I want to invite our viewers and people who are subscribed to my channel, to your Instagram account, to our Facebook groups, to either share this video if they think that it's valuable with their friends, and also in other platforms on Facebook, and subscribe to our next newsletter is for Thanksgiving, where we're going to share all these goodies, and hopefully we can hear from you and you can let us know how it worked for you.
That's really great, Leora. Thanks for having me on today, and thanks for doing good work, and have a happy Thanksgiving.
Thank you so much. I'll see you soon. Bye-bye.